Right now, we are tracking the COVID crisis going on in North Idaho. Hospitals are in critical condition and they are running out of resources.
And we're going to take you outside. Notice the anemometer, it's spinning now. We've got wind picking up across the region.
And Gonzaga coach Mark Few issuing a statement apologizing for his recent DUI citation in Coeur d'Alene. We have the latest on what this could mean for the team. Hi everyone, and thanks for being with us today. The COVID crisis in North Idaho has taken a critical turn for local hospitals. Welcome to Krem2 News at Noon. I'm Laura Papetti. The Idaho State Department of Health activated what is called crisis care standards for hospitals in North Idaho, and we are following these developments very closely. First, Krem2's Nicole Hernandez is taking a look at Kootenai Health, where health leaders there are desperate for more help due to a surge in serious COVID cases.
Kootenai Health says they are already spread thin because of the number of COVID-19 patients they have in their hospitals. They say if they get any more patients, the level of care that they will be able to give will not be the same. Here's what it's like inside the hospital right now. Kootenai Health converted conference and classroom space into bed space. They set up 22 additional beds in the Health Resources Center. 7 of them are already being used. Plus, they did delay elective surgeries. And Kootenai Health Chief of Staff says the one way we can get out of the situation is with vaccines.
You know, I don't like mandates just like any other person in this area, but I do think that people need to make better decisions. And that if they want to make a personal choice, there is a right personal choice and there's a wrong personal choice. And right now, doing nothing is the wrong choice.
Another area being affected by the current situation at Kootenai Health is transfer patients. Normally, they only have to decline 15 transfer requests over the course of 3 months, but these past 3 months, they've had to deny 300 patient transfer requests. Right now, the hospital is caring for 113 COVID-19 patients. 39 of those are in the ICU, 19 were on ventilators as of yesterday. And last week, to help out, Governor Brad Little did reactivate 150 National Guardsmen to come to North Idaho to help the hospitals, and they're also asking for help from retired and inactive nurses. In Coeur d'Alene, I'm Nicole Hernandez.
Nicole, appreciate the update. Over the past few weeks, we've heard the term crisis care used a lot, so we wanted to take a look and see exactly what that means. Crisis standards of care is a last resort for many hospitals, and what it means is the number of patients outnumber the available healthcare staff and resources. And this is indeed currently the case for Kootenai Health and some North Idaho hospitals. The hospitals are overwhelmed with unvaccinated COVID patients, which will now affect someone seeking emergency care. Hospital in crisis care will use non-patient care areas to treat patients. As you heard from the story with Nicole, these could be office spaces or classrooms that have now been converted. Anything that is not normally a patient care space. Hospital staff may be unable to adequately care for the large number of patients. Supplies may be lacking, with the possibility of redirecting life-sustaining resources. Someone near death from illness may only receive what they consider comfort care, as hospital staff will use limited medicine and life-saving equipment on patients with a high chance of recovery. Idaho health officials are warning that these extreme measures could be put in place statewide if the situation continues to decrease or does not get better soon. More than 95% of COVID-19 patients in Idaho are unvaccinated. Here in Washington, the hospitals are seeing a 34% weekly increase in COVID-19 patients needing ventilators. As of Tuesday morning, 251 patients were on ventilators. Healthcare officials say the Idaho hospital crisis will also affect and certainly have an impact here in Washington state. All right, it is 12:04 right now. Looking ahead, President Biden is expected to announce a new strategy to fight COVID-19, and he's expected to make the announcement coming up tomorrow. COVID cases are up dramatically. The weekly average is 300% higher compared to last Labor Day time. Deaths are also up as well, as officials say it will likely get worse.
When we have spikes in cases, we'll have spikes in hospitalization, which are now starting to go down. But much later, we'll also see increases in deaths.
The U.S. has now recorded more than 40 million confirmed coronavirus cases, and across the country, COVID hospitalizations are 3 times higher than they were last September. Now, while the Delta variant continues its sweep across the United States, health officials say they are keeping a very close eye on a new variant that may be able to bypass coronavirus antibodies. The nation's top health expert says the Mu variant is serious, but isn't an immediate threat compared to the Delta variant.
So when we say we're keeping an eye on the Mu variant, we want to make sure it doesn't become more dominant. We actually don't know what the consequences would be. The concern is that it has a constellation of mutations that would indicate that it might evade the protection from certain antibodies. That's what we mean when we say we're keeping an eye on it. But right now, it is not an immediate threat, even though we take all of these variants very seriously.
So this month, the World Health Organization says more studies need to be done to confirm whether the variant could indeed evade existing antibodies. Our coverage on the hospital crisis in North Idaho does continue throughout the day and tonight on Krem2 News, beginning first at 4. In the meantime, for the very latest, just text the word COVID to 509-448-2000. We'll send a link directly to your phone. That'll keep you updated. It is 12:06 right now. We're going to take a moment, take a look outside, a live look, and see what we have going on as we look overlook Coeur d'Alene, the lake. It is a somewhat hazy day out there. You can see the wind is whipping around here in the inland northwest. Meteorologist Jeremy Legoo, he is outside in the Krem2 Outdoor Weather Center. And Jeremy, really you can see how thick that haze is and that smoke that's in the area. How long do we expect that to last?
For the next 24 hours about is really how long that smoke is going to last. But you can see, as Laura mentioned, the anemometer spinning furiously. And that's as wind starts to pick up across the region. And with that wind, you can expect a little more of that atmospheric haze to move in. We sit at 76 right now in Spokane, 75 in Coeur d'Alene, and 68 in Sandpoint. Here in the low 80s in both Wenatchee and Moses Lake, and warming. Right now, AQI sits at 66. We likely trend closer to unhealthy for sensitive groups as we get into the afternoon. That's with our southerly wind kind of pushing in some of the smoke that's down to our south and out to our west. Wind gusts up near 20 miles per hour will persist today. The way you look at it is when you're up near 20 miles per hour, that's when the tree will start to kind of do this. Don't really have to worry too much about broken branches, but it is something to keep an eye on. We've gotten rid of our morning cloud cover. The sun is out. It's just a little bit hazy. And that haze sticks around through much of the day despite that lack of cloud cover. So it says all sunny, and it is sunny. It's just smoky. Temperatures climb into the upper 80s later on this afternoon. We're up to about 88, but keep in mind, we're going to be talking air quality all day long. I'll have a look at the air quality forecast coming up in just a bit.
All right, my friend, thank you. Another story we are following this afternoon. Gonzaga's head men's basketball coach was cited for a DUI in Coeur d'Alene this week. Coach Mark Few was called in by a driver who called him in for what he says was driving erratically and speeding. The coach was stopped around 9 o'clock in the evening on Labor Day in Dalton Gardens. According to the police report, he did not complete a field sobriety test, but did blow at a 0.12 blood alcohol level with the legal limit at 0.08. And coming in new overnight, Coach Few issuing his first statement saying, quote, "I believe as a leader and role model, I am expected to set only the best example. The decisions I made yesterday do not exemplify this standard, and for that I sincerely apologize to you all." He also added, quote, "In particular, I am sorry for the hurt that I have caused to those most important to me, my family, my players, and my program." A DUI in Idaho can mean up to 6 months in jail, a fine of up to $1,000, and a license suspension up to 180 days. All right, so talking about and putting context of what all this could mean for the team. If there is a suspension longer than 3 games, it could be a big deal as the Zags are taking on Texas in the Kennel for their 3rd game of the season. It is expected to be one of the biggest games in Kennel history. Right now, we do not know who would take over as number 2. As of today, the next time we are slated to talk to Coach Few is coming up in about a month at Craziness in the Kennel coming up on October 9th. 12:09 right now. Students are continuing to head back to the classroom this week for their first day of in-person school, and we want to see your pictures. We love back to school pictures. Send us your first day of school pictures by texting them to us at 509-448-2000. And after the break, we're taking a look back at who is returning back to the classroom this week.